So what kind of testing are you usually using?
Well, first of all, I want to make it clear that Lyme and other vector-borne diseases are a clinical diagnosis. They're not one of am I positive or negative on a test. And the CDC even goes through this with their diagnostic criteria. Um, but I like to use specialty labs that are going to test for all species of Borrelia, so that we can make sure you've been fully evaluated, and also are going to look at all of what are called the KD bands on an immunoblot. So they're not just looking at the 10 IgGs and 3 IgMs that you would see in these conventional laboratories, because they are missing about half of what should actually be evaluated. And then there's other labs that look at T cell analysis and C6 and all of these other things that, again, even if you're using a specialty lab, when I'm training physicians, I always tell them, look, you can't just look for positive or negative. You have to understand what these labs are showing, and you have to take that information and bring it into your physical exam, your review of systems, all of the other clinical aspects that you would use to make this diagnosis, which, by the way, does include ruling out all of the other things that could be causing all of the symptoms and presentation of the patient sitting in front of you. One other thing that I don't want to forget to mention is, we talked about the antibody production.
Mhm.
Peak antibody production takes at least 3 to 6 weeks, depending on whether we're talking about IgMs or IgGs. And so a lot of patients will have that tick bite. They'll go into their doctor within the first week or 10 days, they get tested. And of course, their test is going to be negative because their immune system hasn't had the time that it needs to generate antibody production in the level that would register on that test. And again, that's assuming that it's good old, Borrelia burgdorferi and not one of the other species. And by the way, nothing that I've talked about so far even looks at co-infections. So if you
Mhm.
want to test for Babesia, you have to test for Babesia. Bartonella, right? So we have to know what tests to order to appropriately look at all of the species of Borrelia, all of the testable species of Babesia, and all of the testable species of Bartonella, for example.